At Inanda C, we are more like a trauma-based unit. There's a lot of trauma, especially at night, especially month-end weekends. So we run like a trauma unit. So we need that equipment because people will die and we can't help because the nearest hospital will have to wait 2-3 hours for an ambulance. If we have equipment here, we help them here, and that's why we are here anyway in the first place.
So you do see a lot of trauma, and that is probably the main challenge that we have here, that the amount of trauma is quite extensive, and it can range anything from one small little cut to massive trauma that shouldn't be at the level of a clinic, but because this is the closest place for most people, they will tend to come to the clinic before seeking help at a hospital, and that I found is one of our biggest challenges.
We face our problem is infrastructure and long queues and shortage of staff and definitely equipment.
The process of procurement is quite long and lengthy, and with these donations of this equipment we receive them as soon as possible, and we are ready to use them.
For a simple thing like somebody coming saying I've got ear pain and you don't have an ENT set, that person must be sent to a hospital. It's expenses for that person who's not working. When you could have had an ENT set, just look into the ear and treat the person. Because if you don't see what's inside, you can't treat. You have to refer. If you find that it was just wax, if you had an ENT set, you would have just helped the person. The foundation saw the need and they helped the clinic.
It created good outcomes for our patients because now we've got fewer patients with complications as a result, because now we are ventilating them instead of bed mask, ventilating them with a valve. So I think it has done, without it, things would have been very difficult for us.
I was working in our chronic clinic, where you mostly see people with high blood pressure or diabetes, asthma, things like that. And I had a patient who came in with a very slow heart rate. And at that point you could have anything from something that's just a small little problem that doesn't need a massive intervention versus someone who actually needs a pacemaker. And if I didn't have an ECG machine available, I would have had to send this patient who didn't have her own transport all the way to the nearest hospital just to get the ECG. And in our facility we had it available. I could do the ECG, and there and then I saw she had a heart condition that needed a pacemaker immediately, which I could then phone the nearest hospital and tell them I've got an emergency, please accept this patient. And within a few hours she was at the nearest hospital where they could insert a pacemaker before her heart suddenly stops. So those are quite important interventions that if I didn't have it, I don't know how long she would have been waiting for something that's so essential and life-saving.
We are grateful for what STEM Financing has done for us with the equipment that we received.
Well, what I would say is that obviously we want people to continue doing this because it is difficult to go through all the red tape and all the political problems of trying to get equipment at a clinic and trying to motivate why you need this equipment. But from these basic things that we've received, which are really in the medical jargon, it is very basic equipment that every clinic should actually have. To try and get those things would have taken us months to years to get it through the correct pipelines. And having people that are so generous, willing to give money, willing to donate, it helps not just the doctors and the sisters, which you've heard from. It has a massive impact on the patients' lives. They come in, they can, especially the ones that come in really critically ill when we have a ventilator. In the past, I'm assuming you would have had to stand there and physically ventilate someone. If you have a very busy night on a weekend, there's no way that you have enough hands to be able to keep that person alive. So having something like a ventilator is a massive help in a clinic like this, and it really saves lives. So that would be my massive encouragement. You can actually help save lives by donating and helping us.